I think we are here with our colleagues and partners from WHO. Dr. Diallo, the country rep, is here. The entire leadership of KEMRI, PS Medical Service, and Director General of Medicals, or Director General of Health is here. We have this morning unveiled a very important lab. And this lab was done in partnership with WHO and the Gates Foundation. And this is state-of-the-art modern polio laboratory that will help us in strengthening our primary healthcare system so that we can make better decisions in terms of epidemic preparedness and early warning. This lab will help us in building our local capacity. It will create jobs for our scientists, technicians, and public health. This lab, or one of its kind in our region, will help us reduce our reliance on external labs. The test used to be sent to South Africa, to CDC headquarters in Atlanta, Georgia, in the US. It used to take between 35 to 40 days. So now we are no longer going to rely on external labs. That will help us lower cost. That will help us ensure we have sustainability through our domestic investment, working with our partners like WHO. And above all, it will provide our scientists, KEMRI, with a platform for innovation and research. And it will turn Kenya into its ambitious program to become a continental health science lab. Two, this lab will also serve us as a foundation of a broader multi-pathogen genomic platform in order to detect and respond to other epidemic and pandemic threats such as mpox, measles, rubella, and any other emerging enteric pathogens. This will help Kenya's compliance with international health regulations and also strengthen our global health security. And that's why today we have integrated this lab. KEMRI has built a very remarkable genomic sequencing capacity over the past 2 years. And this expanded facility puts us on the brink of all international accreditation now that we can get, which will reduce our turnaround times. It will accelerate outbreak response, and above all, it will firmly establish Kenya as a regional leader in polio surveillance and research. So this lab will be used by many countries, from Yemen to Comoros to Ethiopia, Somalia, Eritrea, Sudan, and many, many other countries. More will come. So that tells you that, and we will ourselves at the Ministry of Health, we will spare no effort to ensure that this facility meets the highest standard as it is of today, and we will do more investment. You have a question.
The last time that we were at the KEMRI was saying that during this financial year, their funding was not what they required.
Passed in the cabinet and improved the level of KEMRI to an institution of strategic national importance. In fact, KEMRI is equivalent to a national security installation. Secondly, a lot of the discussion I will be having in UNGA with colleagues from the global health State Department in the US will be how we can turn around and still support the gains we have made. But I want to thank the scientists and the leadership of KEMRI. Out of their way, we have a lot of funding, and we will continue to support them. But domestically, we will be deliberate to make sure that KEMRI gets its fair share in the budget. Hiyo imetosha, sio? Tutafute chai.